Welcome to our channel. Today we will be talking about the VA disability for breast cancer. Stay with us so you can have a better understanding of what to expect when claiming disability for a condition like this one. Also, before we start, let me remind you to subscribe to our channel and hit the bell button to be immediately notified when a new video is uploaded. Let's start with the basics. What is breast cancer? Breast cancer is a malignant tumor that develops in the cells of the breast. It's the most common type of cancer among women. This cancer can affect men too, but the incidence is very low, less than 1%. So, what can put you at a higher risk of getting breast cancer? Here's a list of some common risk factors associated with breast cancer: age older than 55, female sex, genetics, smoking, alcohol use, obesity, radiation exposure, hormonal factors, and exposure to certain chemicals. Service connection can be directly related to your service, secondary to an already service-connected condition, or by aggravation. In general, the VA will make sure that these three elements are met. Number 1, a current diagnosis of breast cancer. Number 2, an in-service event, injury or illness as the cause of your condition, and number 3, the medical link between the condition and your military service. This link can be evidenced by submitting a Nexus Letter. If you think you need a Nexus Letter, contact us, and our physician will give you a case consultation at no cost. During your CNP exam, the VA examiner will use the Breast Conditions and Disorders DBQ to document the severity and impact of your breast cancer. This information will be used by the VA rater to assign the most appropriate rating if it is determined that the condition is service-connected. We have left a link for you to download this DBQ in the description section of this video. Take a look and familiarize yourself with the questions that the VA examiner will have for you during the CNP exam. The VA rates breast cancer under the diagnostic code 7630. A 100% is assigned while the cancer is active, including during treatment. Then, the VA will request a mandatory examination 6 months after the treatment is completed. If the treatment was successful and there is no active cancer, the veteran will no longer receive a 100% rating, but a rating that will reflect the residuals. When the residual is related to breast surgery, it will be rated using the code 7626. It can go from 0 to 80% depending on the type of surgery and if it affected one or both breasts. And if the residuals affected other parts, organs, or systems, then it will be rated according to the rating established to cover each one. For example, scars, lymphedema, or disfigurement, limitation of arm, shoulder and wrist motion, loss of grip strength, or loss of sensation. To ensure a successful claim, here are some tips. 1. Keep copies of all documents, including medical records and evidence of the places where you were deployed or stationed. 2. Clearly explain how your condition affects your daily life during your CNP exam. 3. Get a Nexus Letter to help you establish the link with your service. 4. Seek assistance from veteran support organizations or a VA-accredited attorney if needed. And 5. Appeal if your claim is denied. Pursuing a VA disability claim for breast cancer might seem daunting, but with the right information and support, you can navigate the process effectively. For more information and assistance, check out the resources listed in the description of this video. Stay informed, stay connected, and thank you for your service.